And Paul, we're now live.
Okay, good afternoon. Thank you all for joining us today. Before we get started, we would like to begin with a brief message from Sylvia from our communications team to our Spanish-speaking viewers. Sylvia?
Sylvia is joining us right now. Message for our Spanish-speaking viewers.
Hola, para las personas que están escuchando esta presentación en español, por favor vayan al canal del CNAO Sonoma en YouTube y ahí pueden escuchar la interpretación del español. El enlace está en la publicación en Facebook de esta presentación. Muchas gracias.
Okay, thank you, Sylvia. We have a lot going on today. I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID-19 and vaccination update for Friday, March 5th. As I said, we have a number of updates to give you today, but to start us off, I'd like to welcome and thank Supervisor Susan Gorin for being with us today. Supervisor Gorin?
Thank you, Paul. I'm delighted to be here with such an amazing team of folks who've been working essentially this past year to develop a system of testing and vaccination that serves us so well. And I am happy to report that this week, Sonoma County's metrics for the first time show that we are on course to move into the red tier within the next 2 weeks. I say on course because I want to emphasize we are not in the red tier at the moment. We're still in the purple tier, but we are en route to get to a better place very soon. So what this means is that for the first time since we entered the state's blueprint for a safer economy in August, our case rate is at a place where we are eligible to move out of the most restrictive purple tier. If our metrics stay at or below their current levels between now and March 16th, we should be able to move into the red tier. This in general will allow restaurants and businesses to open up about 20% more than they are now. Dr. Mace will get into more detail shortly, but this is such a positive sign that our mitigation measures and campaign to get vaccines administered as quickly as possible is paying off. And if we can get into red, hopefully we can maintain our momentum and move into the orange tier. And from there, we can begin to imagine the day when this pandemic is behind us. That said, we continue to receive disappointing news from the state about our vaccination allocations. Even as we ramped up our capacity to rapidly get shots in arms, the supply the state sends us continues to remain flat. Next week, we'll be receiving 7,700 doses. As we have said before, we have the capacity to administer 6 times that amount here in Sonoma County, thanks to the network of clinics and hospitals that we now have at our disposal. But the supply continues to limit our ability to get shots in the arms. For now, our main message continues to be, please continue to practice public health protocols, including wearing a mask, avoiding large gatherings, and get tested. We want to assure you that these days, COVID tests are easy to find, and in some testing sites, appointment can be made the same day. Testing helps to identify and isolate cases so that we can prevent outbreaks from happening. Testing can also help us identify if there are any variants spreading in our community, like the case of the UK variant that we discovered in Sonoma County this week. Testing also helps reduce our metrics that determine when we can reopen more of our economy. So if you want to help us stay on course to move into the red tier, reopen restaurants, gyms, schools, go and get tested. I should also note that testing is easier and more comfortable than in the fall. And we're going to have a live demonstration of that in just a few minutes. Now I'd like to turn it over to Dr. Sundari Mace, our public health officer, and Dr. Urmila Shendy, our vaccine chief, to present some data about the pandemic and our vaccination effort to date. Thank you both for the amazing work that you continue to do.
Great, thank you so much,
Supervisor Gorin, and thanks to everybody who's participating today. I'd like to speak a little bit about our metrics. As was noted already, we continue to inch closer to moving out of the purple tier in the state's blueprint for a safer economy. I'm so happy to say that for the first time this week, our metrics were low enough to qualify us for the red tier. Our overall testing positivity has dropped to 3%, and our testing positivity in the lowest quartile of the Healthy Places Index is now 4.9%, down from 5.2 and 5.5% earlier this week. Both of these metrics are now in the orange tier. If these numbers hold for a full 2 weeks, starting on Tuesday of this week, then we can move into the red tier and reopen in areas such as indoor dining, gyms, and movie theaters. You can go to the CDPH website to see what the full list of things that would be open if we moved into the red tier and get more information there. Our adjusted daily case rate per 100,000 residents also continues to decline, and that's really good news. It means that we have less and less transmission of COVID-19 in our community. That case rate is now down to 8.2 per day per 100,000 population. And if that hits 7, then that would be another way for us to qualify for the red tier immediately. We also welcome the news this week that the state is actually going to be adjusting the metrics for reopening once it's distributed 2 million vaccine doses to residents in the communities hardest hit by COVID, those that fall into that lowest quartile of the Healthy Places Index. Unfortunately, none of the 400 zip codes identified by the state as being in the lowest quartile for the state are in Sonoma County. However, we hope that we'll also benefit soon from this effort to prioritize our most disadvantaged and at-risk residents in the state for vaccination. We also welcome this effort to help counties move through the reopening tiers at a faster rate. We're told that once the state has distributed the 2 million doses to the lowest quartile communities, which is expected in the next 2 weeks, we would only need an adjusted case rate of 10 per 100,000 per day to move into the red tier. While we're on track to move into the red tier even without this additional tool, it's helpful to know that it's available to us as a backup if we need it. Furthermore, under the new rules, once 4 million doses have been distributed to these same low-income communities, we can move into the orange tier, that is 2 tiers down, with a case rate of 6 and open even more of the economy. So while we're still in the most restrictive purple tier right now, there's hope on the horizon. So I also want to just remind everybody that as we move forward and our metrics look better, it's really important to continue to adhere to all those mitigation measures that are helping us get there. The facial coverings or masks, the social distancing, and the general hygiene measures. And as Supervisor Gorin already stated, testing is a very large part of this strategy. So please go out and get tested if there's any concern or you just simply want a test result. Now I'm going to turn this over to our vaccine chief, Dr. Shende, for an update on our vaccination campaign.
Thank you, Dr. Mace. So as of today, we've administered 156,896 vaccine doses, including 66,994 residents with first doses and 44,951 residents fully vaccinated with 2 doses. Of particular note, more than 75% of our residents who are over 75 years of age have received at least 1 dose, with about 33% now being fully vaccinated. Meanwhile, 60% of our 70 to 74-year-old population has also received at least 1 dose. This is great news because those represent our residents who are more likely to have serious complications from COVID-19. Our goal had been to target these populations and to do it sequentially. And now we are seeing the results of that. They are getting closer to becoming fully vaccinated, and that's great. Overall, we've now administered 1 dose to more than 27% of our eligible population of 16 and above. Unfortunately, as Supervisor Gorin noted, the bad news is that our allocation next week is going to be flat once again, with just 7,700 doses. This means that, as with this week, we will be administering mostly just second doses at county-supported clinics this next week. We have been able to secure just enough vaccines to make sure that we do not have to postpone any second doses. That said, we'll be getting 1,700 doses of the new Janssen vaccine, or Johnson & Johnson. And since these are just one-shot vaccines, we'll be allocating these only to those who have not received the vaccine before. On that note, I want to emphasize that while we will be able to get by next week without having to postpone second doses, we remain concerned about what will be coming the week after that and 2 weeks from now, when we're facing a large number of appointments for second doses. I will let our vaccine chief, Ken Tassif, talk more about that in a little while, but it's a concern because if we don't get more supply from the state, we may have to cancel appointments for second doses, but we're working very hard to avoid doing that, and we'll continue to do so. Finally, I want to remind everyone that Blue Shield, the state's third-party administrator, is scheduled to take over vaccine distribution for Sonoma County starting on Sunday, March 7. However, it's unlikely that there will be much change noticeable right away. We're told that this will be a phased transition, and we're told to operate as business as usual for now. In fact, we're not expecting to be fully under the third-party administrator until the end of the month. In the meantime, we're encouraging residents to go to myturn.ca.gov website and register if you haven't already done so. By registering, you'll be notified when you're eligible, and we'll be given a link to make an appointment when one is available. And it's not fully operational as yet, but residents can go on and register now so they're ready when it does go live. With that, I'll turn it back now to Paul Gullickson. Thank you.
All right, thank you, Dr. Shende. So we now have something special. We are going to go live to one of our testing sites where we have Josh Patrick from our health team, who is going to demonstrate how easy it is to get a test these days. Josh, are you there?
Yeah, I'm here. Hello and welcome everybody to one of our many testing sites here at Bayer Farm. This is one of the few options that people have to come and get tested here in Sonoma County. These are our lovely bilingual staff members who do our intake, bicultural bilingual, super helpful for our community. So when Noemi here is checking in and she's getting asked a few questions about kind of like phone number, email, stuff like that to get the information sent to her results, and to make sure that we're not making any errors and sending the wrong information to the wrong person. And we don't ask any kind of information about immigration status or anything like that. We don't ask for ID or insurance information. Completely free and super quick and easy. And after they're done here, they end up going over to the testing station and we verify some information. And then we offer the self-swab for them over there, and we can actually go check in with Herman and witness how that happens. And over here, Herman's getting his information verified so that we know he's the right person getting the swab.
Herman Hernandez, June 8, 1986.
And this is our lovely AMR staff, and they do most of the swabbing. So Herman here is going to get a new type of swab that we've been using. It's different from the old type. We used to do a nasopharyngeal swab, which is a little bit uncomfortable for the general public. So we switched to a self-collection swab. And how that works is we take a swab, it goes into your nostril on one side, you go on the inside for about 15 seconds, and then you come out, you go in onto the other side for 15 seconds, and then you're done. And this type of swab doesn't go in nearly as far as a nasopharyngeal, so the general public usually tolerates that a little bit better.
And the other side as well, and then you're all done.
Josh, is everybody able to do it self-administered now? Is that the way it works?
That is correct. And they do have the option, if they want our AMR staff to do it for them, we can do that as well. There's plenty of options out here for them. So we give them whatever they're comfortable with. So Herman, how was it?
Oh, way better. Way better. I did it earlier on and it really, really hurt. It almost felt like they were touching your brain, but now doing it yourself, you don't have to stick it up as far. Way easier.
Awesome. We're glad to hear it.
Yeah.
All right.
Awesome.
And
cool.
one last thing I wanted to say, that it's super important to come out and get tested. We're trying our best to get out of the purple tier and into the red tier. So the more people that we have coming out to test, the better. And it's super important that people continue to get tested on a frequent basis. And that's because, you know, even though you are vaccinated, you could still be transmitting the disease. It's a possibility. And we really just want to keep people safe and their families safe as well.
That's great, Josh. We also have Darcy Richardson, who's the head of our nursing for this pandemic response. Darcy, is there anything you want to add about the testing process?
Well, I really want to say thank you to our testing team and our volunteers out there who are demonstrating the swabbing, because it is a lot easier than it used to be. And having had the nasopharyngeal and the nostril swab myself, I can tell you it's a lot more pleasant process and quicker. But I also wanted to say that it's important for everybody to think about getting tested, not only because we're trying to get out of the purple, but because it's really important for everyone to know what their status is. About a third of people who have COVID are walking around with very few symptoms or no symptoms at all. So you might not even think you're sick. You might think you have a little sniffle from seasonal allergies, or you have a little bit of a headache. But those are also signs and symptoms of COVID. And that's the thing about COVID. It's kind of tricky, and it can mimic a lot of other minor illnesses. So we don't know who in the community might have COVID and is walking around and could be transmitting to other people because they're not sick. So if you're out and about in the public, if you're meeting with people, if you're an essential worker and you're working in a facility where you're in contact with others, it's a good idea just to get tested periodically so that you know what your status is and you can protect your family and your community. And help us reopen our businesses and our schools as quickly as possible. So I encourage everybody to go out and get tested.
That's great, Darcy. Thank you very much. And thank you to Josh and to our patient, Herman Hernandez. He seemed like a very good patient, and we really appreciated him walking us through that. So with that, I'd like to go to Ken Tassif. Ken, if you could, Ken is our vaccines chief, our vaccines manager. And Ken, if you could talk a little more about our allocation and what we're expecting in the days to come.
Sure. Thanks, Paul. Appreciate that. So, we, over the last 6 weeks or so, our allocation has been fairly flat, and in fact has been lower recently than back in January. We've been managing the inventory as it comes in, and basically as we get inventory in, we always allocate second doses first, in order to ensure that people get their full regimen of doses. And only after we've allocated our second doses do we then take the remaining doses that are available and use them for first doses. Now, back in early February, the state talked to us about trying to zero out our inventory as quickly as possible. The whole idea was to get all of the doses into to be administered, and they promised that they would have second doses available. Our concern has been that we might not have enough second doses, and we've seen what happened, for example, with Sutter and their inability to do second doses. This week, all we have had the ability to allocate was second doses, and even next week, all we will have Moderna and Pfizer available for are second doses. What we're concerned about, and we're monitoring right now, is that in the weeks following, we did a number of first doses that will be coming due in the next 2 to 3 weeks, and we're concerned that with flat allocations, we may not have enough doses to do second dose allocations. Now, that being said, we are collecting all the information, and we are communicating with the state about how many doses we anticipate we'll need, and we'll be telling the state that we expect to get them. But in the event that those doses do not get allocated to us, please rest assured that while there is a 21 or 28-day minimum waiting period to receive doses, there is additional time afterwards to receive your doses. So if your doses don't get administered immediately at 21 and 28 days, we will be getting appointments for you, and we'll be getting those second doses in place. But we're working closely with the state to try and prevent that eventuality.
Okay.
So,
And Ken, before we go, do you want to say anything about how we're handling the Johnson & Johnson vaccines? We know what you mentioned, we're going to be getting some of those next week as well.
right. Yes. We're getting 1,700 doses of Johnson & Johnson, and we're so the state has asked us to allocate doses based on 70% to those 65 and above, and 30% to those based in the tier priority system, the occupational tier priority system. So next week, we have a number of different areas that will be using those doses. Some will be will be with homebound seniors. Some will be in a drive-through clinic where seniors that may not have the mobility to get into a site can go, and others will be in our regular sites. In addition, for the occupational tiers, we'll be allocating doses to various locations, primarily through our FQHCs, our community clinics, to be used for various occupations like first responders, farm workers, grocery and restaurant workers, and of course, school teachers.
So what I'm hearing you saying is we're not handling the Johnson & Johnson vaccines any different than we are the other vaccines. Is that right?
No. As far as we're concerned, it's all vaccine that's intended to hopefully prevent the spread of or people from having serious reactions to COVID-19. That's correct.
Okay. Well, listen, we thank you all for your involvement in today's report. That was excellent, and we appreciate it. Thank you.